Hey, I'm Lana, Lana's Lantern Holistic Women's Health and Fitness. I am a nurse turned preventative health practitioner. I advocate for us women and the men in our lives to take charge of our own health. To, of course, if you have any problem, go to the doctor. But I also recommend you go to a functional medicine doctor as well, or a naturopathic doctor. I recommend that you research things on your own and you advocate for yourself with healthcare professionals because they're only taught a certain amount of information. But when we look at our health, there's a lot more to the picture. And what can we do ourselves to take care of our health? So today I'm going to be talking about my own journey with my hormones. And trust me, it's not boring because we'll be talking about benign liver tumors, we'll be talking about uterine fibroids, we'll be talking about sugar and alcohol and how all of that works together to impact your hormones, particularly during pregnancy, fertility, perimenopause, menopause, and even postmenopause. So have a listen. I am sharing candidly about my own health and my own journey, and I will continue to share with you about this journey. I am someone that has put my health, so over the course of having 4 children, I would say I did put my health on the back burner. But over my lifetime, I have been really interested in healing myself as natural as possible, preventing things as much as I can, taking charge of my own health. And I have had my own health problems in just the last few years. So I want to share my story so that you know that there's no shame in struggling. There's no shame in having a health problem or crisis. There's a lot of resources, not just your medical doctor, and you are worth digging to find out what the source of the problem is so that the source can be addressed, not just a band-aid. All right, so here we go. I hope you have a wonderful day, and I look forward to chatting with you in the future about how this journey is going for me, and I will candidly share all the information I can. Best to you. Bye. Hi, Lana here. Lana is Lantern Holistic Women's Health and Fitness. It is Hormonal Hump Day, and I am going to share about our hormones, ladies, our liver, and my vulnerability, so that I can help to motivate you to take care of yourself, put your health as a priority, and think outside of the box that your health has been put in with our mainstream medical system. So 2 years ago, I had some right upper quadrant pain, and there was something else going on at the time, and I don't recall what it was, but I went to the emergency room in British Columbia because they don't have walk-in clinics up north, which is ludicrous. So you have to wait to see a doctor in an emergency room for simple things. But anyways, if you don't have a family doctor. So I went to the emergency room, had all of the scans done, and the doctor came back and told me that I had a hepatic hemangioma, which is a benign tumor on my liver. And she said, don't you worry at all about this. It's so common. In fact, I have one myself. And it's so common, don't worry about it. It's nothing to be concerned about. And I think she did a follow-up scan to see if it had grown in size, and it hadn't. And there's nothing to really worry about if it's not growing. So at the time it was 4 centimeters. Oh, shoot. I can't remember. But anyway, so when I look back and I think about the doctor that was telling me not to worry about this, no information at all about it, but I look back and I remember that she was around my age, maybe a little bit younger, and probably about 30 pounds overweight. Dynamic personality, very nice. But when I look back, and now with the knowledge that I have about hormones and our liver metabolizing our hormones and how so very important our liver is, I realize that was a disservice, and I realized that I should have dug deeper at the time. But I was told not to be concerned because it's so common, so I wasn't concerned. So now fast forward 2 years, and I have started having some urine infections, like 3 in 6 weeks, basically. One had turned into a pretty bad kidney infection. And so I saw a doctor, got an ultrasound done, and the ultrasound showed that I have a fibroid, a large fibroid in my uterus. And the doctor actually, when I did my follow-up, he actually said that there's nothing actually to be concerned about because my bladder and my kidneys and my ureter look fine. And I said, well, I had seen the results. And I said, what about the uterine fibroid? It's quite large. It's 5 centimeters by 5 centimeters by 4.5 centimeters. And he said, oh, what? And he looked back and he said, oh, right. It just doesn't say that there's follow-up needed on here. And I said, but wouldn't that affect, because the problem I've been noticing is that my bladder isn't emptying. And I think that's why I've been getting urine infections. I've noticed the anatomy changing and it's hard to empty my bladder. So he has now ordered an MRI to see how big this is. And he did admit, yes, that could be a factor in my bladder issues. So now I've done a lot of research and, I know the treatments for a uterine fibroid, they're very common during perimenopause, getting larger, and then it's very common that they actually shrink after menopause because it's an imbalance in hormones that affects these fibroids. And typical treatment is laparoscopic or hysterectomy. And I don't want either because I like my uterus. I want to keep my uterus. I don't want to go through early menopause. And I also know that there's a very high chance that the fibroids can come back if you have a fibroid removed laparoscopically. And we want to look at the cause of these problems, right? So the main cause is an imbalance in estrogen, also high insulin levels. So if you are eating carbohydrates or you're eating often and your blood sugar gets spiked, your pancreas releases insulin to deal with that blood sugar and bring it down. And if you're doing that a lot, this can cause these fibroids. And another cause is low vitamin D levels. So there are higher percentage of women that have darker skin actually have these fibroids. But I do want to say that 80% of women have fibroids. This is a huge problem. And a lot of women may not have real problems resulting from the fibroids, but they actually might not realize their hormones. The cause of the fibroids is because their liver isn't metabolizing the hormones properly, and or they have chronic insulin levels, high insulin levels, or they have regular exposure to toxins, which can be in our food, our pesticides, plastics, other environmental toxins and high amounts of stress as well. So looking at the cause for myself, obviously the hemangioma is impairing my liver from clearing effectively my hormone, my estrogen. And how do I fix that? So, well, as I've been teaching in Lana's Lantern Holistic Women's Health and Fitness, to support our liver, we reduce our sugar intake, we reduce our alcohol intake, we reduce our plastics exposure and toxins exposure, we reduce our stress as much as we can. And then we can eat a lot of leafy greens, cruciferous vegetables, and there's a few different supplements that we can take to help our liver along. We can also drink a lot of lemon water, apple cider vinegar. There's milk thistle you can take. You can research herbs for helping your liver. I plan on drinking dandelion tea, yarrow tea, burdock tea, marshmallow tea. I'm going to make a liver blend tea for myself. But the point is, whenever we have something creep up, we need to look at the cause, the root cause of it. And yeah, I could just go through the motions and get this fibroid removed, or I could try to shrink it myself, at least try first. So action plan for me is to reduce my sugar intake. So I regularly kind of haven't really been craving dark chocolate lately, but I do eat 70% dark chocolate. I was eating it quite regularly, but I've been cutting back anyway because I haven't been craving it. And I don't really eat much sugar. I don't eat processed foods. That's another big one that uterine fibroids can be attributed to eating processed foods, like the chemicals in the foods. I do eat a lot of meat though, and not always grass-fed, grass-finished beef or organic chicken. I try my best, but there are definitely conventionally raised animals that I eat regularly, and then I know that they have a lot of hormones. I don't eat dairy. That's another big one that can cause fibroids because dairy has so much hormones in it, in itself, like dairy milk, cow milk, sheep milk, goat milk. It's actually produced to grow a baby, right? A calf. So it has a lot of hormones in it. Never mind conventionally raised animals with all of the hormones that they're fed or injected with. So I don't eat dairy. That's not an issue, but I was regularly actually using an almond creamer for, I started to treat myself in the afternoons with coffee with an almond creamer, and like a fair amount of it because it's delicious. So I'm giving that up. And another really big thing that I want to point out is that I started drinking San Pellegrino in plastic bottles about a year, 6 months to a year prior to the hepatic hemangioma diagnosis. And that, you know, I came from our property with spring-fed, mountain, beautiful spring water with like no treatment and just gravity-fed spring water and like minerals intact, so good. And then we moved from that property and I started buying San Pellegrino because I found I was missing the minerals in my water. And then, you know, I started having this upper right quadrant pain, and I really wonder about that. I also during that time, my husband started to make wine for me, and I was drinking wine almost daily as a de-stressing tool. And I believe that greatly affected my ability to process my excess estrogen in my body. And then now I've been storing that excess estrogen in my uterus. And that is the cause of a fibroid. So, ladies, if you have real fullness in your pelvic area, inflammation in your body anywhere, if you're really struggling with menstrual, premenstrual, perimenopausal, menopausal problems, your liver is not working the way it needs to work, and it needs help. And that comes through your lifestyle changes. No one is going to save you or save your liver or save your hormones. If you go and take hormone replacement therapy, your liver has to deal with everything still. No one is coming to fix this for you. You have to do it. So educate yourself. I recommend seeing a naturopathic doctor. And if you can't afford it, there's a lot of information specific to a problem by naturopathic doctors on YouTube. And I've seen a naturopathic doctor, and I've compared the doctors on YouTube, and I don't see a problem. I am trusting what they're saying because they're looking at root causes and what you can do to change your lifestyle. So help your liver process your hormones, okay? I stopped drinking wine. I got my husband to stop buying or making it or buying it because it's too tempting. It's here at the house, and I had a stressful day. I need a glass of wine. And when I'm drinking wine, my liver is busy dealing with that. And all the other problems are erupting because my liver is consumed with a toxin. So I stopped drinking alcohol completely for 6 months. Then I decided to have a glass of wine, enjoy a glass of wine on date night out to dinner with my husband. And, come on, girls, get honest with yourself. Get honest with the people around you. Like, how long has it been since you didn't have any alcohol? Do you know how clear your mind is without alcohol? How much more in control of your emotions you are? Same with junk food, sugar, processed foods, all those treat foods that we tell ourselves. Is it a treat to have your hormones going crazy as a result? To have this large tumor in your uterus so you look like you're like 3 months, 4 months pregnant all the time? And you are getting urine infections because of that? Like, is it, take charge. Take charge, get honest, get real. Because all of these things add up. I can't believe how ignorant I've been about drinking bottled water from a plastic bottle that's been sitting in that bottle for who knows how long. It's from Italy. So I just really want to open up the honest communication about your hormones and your health. Your organs are your best friend, right? Like, if we don't treat our best friend well, they eventually go away. And that's what happens with our body. Our body is just going to disintegrate. So there it is. I will keep you posted on my journey. I can tell you that this week I have not had that creamer in my coffee. I haven't had any chocolate. I stopped buying the plastic bottle San Pellegrino. And I haven't had any sugar. I haven't had any alcohol. I can say that my pelvic region inflammation is reduced. I have been back out running slower because I'm afraid. I'm afraid of triggering a problem, you know, and that's too bad because I've been training for a marathon, and this has affected my running, my goals that are so important to me are affected. So now I'm running way slower and shorter distance, and a marathon's not happening this fall, but I'm back running, so that's awesome. And I've also been mindful of my weight training and not putting any pressure on the pelvic region. So yeah, we've got this, we can do this, and keep each other in the loop. Like, be honest with yourself about how you're treating your body, because no one is going to fix it for you. If you have to go and get surgery, the problem can return because the root cause hasn't been fixed. More problems can happen. In fact, some of the risk factors of the laparoscopic surgery for the fibroid or hysterectomy are the same factors that you are doing the surgery to avoid these problems. So educate yourself as much as you can, also in alternative sources, so that you know what's going on and you know the root cause of things. Hormonal Help Hump Day. Thanks for listening to my story, and we have a lot of power in just reading and listening to other people's stories. And please share if you have any experience with shrinking a uterine fibroid naturally, because I'm all ears. And let me know if you have a hepatic hemangioma. How common is this really? Like, I want to hear from women. I want to hear about diagnosis and how perimenopause and menopause went for them, because I believe it really affects your ability to metabolize your hormones, particularly estrogen. And we need to get rid of that excess estrogen, baby. Okay, bye.